By now, you have a basic understanding of what's involved with total joint replacement. So let's take a few minutes to focus on the exercise program for hip surgery patients like you.
Hello, my name is Don, and this is Tim. We'd like to demonstrate the exercises you'll be doing after your total hip replacement. If you're watching this video before your surgery, we recommend you practice them ahead of time. These exercises will be started in the hospital after your surgery. You will continue them after you go home. Building up the muscles of your hip will help you recover quickly and safely. These exercises should be done on a bed, lying flat on your back. Don't try to get down on the floor to do them, especially after surgery. You'll progress to doing 2 sets of 10 repetitions for each exercise, 2 to 3 times per day. If you have a remote control, you may want to pause the video after an exercise is demonstrated, do your exercises, then restart the video to continue with the next exercise. You can also follow the exercise page in the PT section of your hip book. Starting as soon as you wake up from surgery, you'll be asked to do ankle pumps and circles about every 30 to 60 minutes you are awake. This helps with the leg circulation and helps prevent blood clots. Be sure you pull your foot way back to stretch the calf muscle, then way down. You can also make big circles with your toes. Do about 10 repetitions of pumps and circles. Next is the Glut Set. Squeeze your buttocks muscles tightly together. This is like trying to squeeze something between your cheeks. Hold it for about 2 seconds, then relax. This should tighten up your gluteal muscles. Next is the Quad Set. Press the back of your knee down into the bed and hold it tightly for about 2 seconds, then relax. Should tighten up your quad muscle, which is the main muscle of your thigh. Next is external rotation. Keeping your knee straight, roll your leg out so that your foot points outward. Hold this for 2 seconds, then relax. Don't turn your leg inward. This will strengthen the muscles in the back of your hip, which helps keep your hip in place. Next is the heel slide. Bend your knee by sliding your heel back towards you as far as you can comfortably go. Then slide it back out. Only do this while you're lying flat on your back. If you were to do this while sitting up like in a recliner, you could bend your hip too far. This is a good exercise for loosening up your knee and your hip. Next is abduction. Keeping your leg straight and your foot pointed up, slide your leg out to the side as far as you can comfortably go, then slide it back in. You may need help with this for the first few days. This strengthens the abductor muscles, which helps keep your hip in place. Next is the short arc quad. Have someone place a large towel roll, about 3 or 4 towels wrapped tightly and taped, underneath your knee. Straighten your knee completely. Hold it for 2 seconds, then let it back down. This strengthens the quad muscle, which is the main muscle of your thigh. This next exercise is standing hip abduction with your surgical leg. This is an exercise that you can begin after returning home from the hospital. Stand up and hold on to a counter or a dresser with both hands. You want a surface high enough that you can hold on to while standing straight up and not leaning over. Raise your surgical leg out slowly to the side, hold it 2 seconds, then lower it slowly back down. Go as high as you can comfortably go, but don't force it and don't bounce it. Make sure that you stand straight while doing the exercise. Don't lean forward or to the side. Keep your toes pointed slightly outward and keep your knee straight. This works the muscles that help stabilize your hip. You can work this exercise into a routine, such as when you go to the bathroom, stand at the sink and do them. Next is the standing hip abduction non-surgical leg. For those of you who want to do more advanced exercises, you may do this next exercise about 2 to 3 weeks after your surgery, or when you are able to put full weight on your surgical leg. In the same position, you will do the same motion with your non-surgical leg. It's very important that you're able to bear full weight on your surgical leg so that you can raise your other leg out without dropping your pelvis down. Also, keep your knees straight. This can be a great strengthening exercise for your hip, but it won't do any good if you can't hold your pelvis level while you do this. If you can't hold it, then try it again in a few days. Walking is also a great exercise. This means household walking for the first 1 to 2 weeks, then gradually progressing as you are able to. These exercises will help speed your recovery and improve your outcome. We wish you well in your recovery.
Although you'll be doing lots of exercises after surgery, it's important that you consult with your physician before resuming sports or other activities, and be sure to watch the special program on hip precautions.